We're three medical doctors, Dr. Niamh Lynch, I'm Dr. Moritz Rasney-Chiala and Dr. Darren O'Leary. We're also friends. We have a very active group chat and we'd like to share some of those thoughts with you. This is No Scrubs. So as you guys know, we have this podcast and we like to discuss a different issue or topic every week. So this week, actually, a discussion that we had amongst ourselves in our own kind of WhatsApp group, and it's an important discussion, and I think it's something we mightn't give enough time to, is the idea of patient blame. And there's lots of different facets about this. Sometimes I think patients may feel that doctors might blame them for a particular illness. And I think as well, publicly and in public and amongst our friends and family, there have been many of us probably might know of incidences where we felt we were blamed for having a certain illness or condition, and parents might feel blamed and shamed by other parents, and so on and so forth. And it's something I think we all feel very strongly about, and probably potentially, maybe inadvertently, we may have also done to our friends and family over the years as well. I'm sure none of us are completely guilt-free in this department either. So I think, Niamh, in particular, it's something you feel very strongly about.
I actually encounter it every day. So, particularly in the area of pediatrics, around neurodevelopmental issues. There, historically, we know that when children had a diagnosis of autism, there were some horrendous so-called studies that sort of tried to place the blame on the mothers for being distant and cold. And obviously, we know that is not correct at all. Um, and a lot of parents still have to navigate blame and shame when their child gets a diagnosis. And of course, on the medical side, we know that children who are diagnosed with any sort of neurodevelopmental condition, it's a combination really of mostly genetics and a little bit of environment. And I just wish that parents didn't have to carry that with them, as well as the whole sort of difficulty about wrapping their heads around the diagnosis. And one of the most common one obviously is around vaccinations, and well-meaning relatives saying, "Oh, did you get them vaccinated? Could be because you got them vaccinated," and things like that. And that's really tough for parents. I hate to see that. And then the other thing that I feel very personally is the sort of shaming aspects around health conditions that can be associated with lifestyle. So my own personal experience would be having had gallstones. And I first had symptoms of gallstones when I was 25. My hair was brown. I was thin. I didn't meet this awful 5F criteria, which
You
is
mean you weren't female, fat, fertile?
when I was female, obviously. So female, fat, fertile, 40s, and fair, right? So when I eventually ended up in a hospital where they diagnosed me, they could eyeball me and say, well, she has the symptoms and she meets the 5F criteria. Those criteria are horrendous. I had a male relative who had one attack of gallbladder pain, and then next week he had his gallbladder out. No questions asked, no finger wagging, no telling him to lose weight. And yet I had to run that gauntlet when I was finally, after the bones of 20 years of having had symptoms, I was finally diagnosed. So that made me kind of annoyed.
Yeah, I can imagine.
Yeah. And then the other thing I find very difficult is having sort of lived with a tendency to put on weight easily all my life. I think the narrative around obesity is very, very damaging and very finger pointing and blamey. And so those are my little bugbears.
I mean, they're little bugbears, but they're big bugbears if you're somebody who's living with something that you feel you need to justify it every day or make a case for yourself. I'm just actually want to bring Darren in here because obviously, touch wood, and anybody who can't see the video, I am frantically walloping my head here because I have a wooden head. I haven't had, a diagnosis like that or an illness or a condition that would make people judge me to a point anyway. Whereas I know for Darren in particular, you kind of had a bit of that feeling too yourself a few years ago.
Yeah, similar to what Nia was describing in herself and with her friend. And I never realized this until I was diagnosed with a serious illness myself. Is there is stigma around illness? I never realized that you can feel self-conscious about your health, and you can feel self-conscious about an illness, and an illness is stigmatized. And I didn't actually know that because all of my life I was just working, treating patients, and I never thought to think about stigma or how, a patient might feel self-conscious about an illness. Like I knew there was a lot of, I suppose people did a lot of introspection. I think the most common question I'm asked when I diagnose somebody with a new illness is the most common thing is something I'm eating, and it seldom is. Like Neve said, it's mostly a kind of a combination of, like, most illnesses are a combination of um, genetics and then a little bit of the environment. They say that, like, genetics load the trigger and the environment pulls the gun, like the epigenetics piece. It's seldom, something we're eating or doing. It's just a bit of epigenetics and bad luck. But when I was diagnosed with cancer, I felt so much just like shame about it. Like I felt, but I'm a doctor. I'm not supposed to get sick. Now that I've gotten sick, I failed at this thing of health. So, like, obviously I just can't be a doctor anymore. I truly believe that. I believed it. I packed away all of my stuff. I put it away and I was like, well, that's it, because I really can't be a doctor because people can't trust me now anymore because I became sick. And that was just a belief that I can't believe now, looking back, that I had that. But it was kind of a part of the shame piece. And then I also felt a lot of guilt that I was bringing all of this worry to my family, that, everybody was worried and upset. And I felt guilty about that. And then before I had, could look back at my old notes, I didn't know when was my last smear? Was I not going for my smear test? And you know, I remember thinking, if my smear tests aren't up to date and I've now been diagnosed with cervical cancer, like, I'm in trouble. People are, I've made a really bad mistake and I've really, like, effed up, and I've caused my family a lot of hassle here. So it was just all of these just these feelings that I had that I never realized patients feel, such a complex, feelings of shame, guilt, regret, you know, um, and whether it's feeling like blame from yourself or like perceiving blame from those around you, but may or may not really be happening. Like the way Neve said, the well-intending people might say comments, things like, well, did you get the vaccine? Like you say, in my case, and nobody said it to me, but people could have said, did you not get the HPV vaccine? I didn't, because it wasn't around when I was, like back then, we'll say, I wasn't as educated as I am now. So it's very, very complex. And, then in terms of what I see it usually as, you know, like day to day, like Neve said to her friend with the lung cancer, is saying, I didn't smoke, like saying, I don't know I have this and I just need to kind of put that out there. I had a friend recently diagnosed with skin cancer. Immediately she said to me, um, I'm going to do better with sunscreen, kind of trying to, like, apologize for an illness or something, and then people, if they have liver disease, people think, did they drink to excess? And, like, there's lots of other causes of liver disease other um than alcohol. People get skin cancer even when they're diligent with sunscreen and um don't use sunbeds. People get breast cancer and cervical cancer even when they do all the right things, don't drink, don't smoke, go for screening, get vaccines. So, a lot of ill health is bad luck. And I think just we blame ourselves a lot. Um, and then there's the risk factor piece. This was, we learn that every single time a doctor learns about an illness, we define the illness and then we go to, risk factors and causes. And the risk factors are things that, you might be asked about during a consultation. Like, for example, if you're diagnosed with cervical cancer, you might be asked, are you a smoker? And that's just trying to gather information from the doctor's end. They're not really trying to blame you, but of course you might feel blamed if you did smoke. Now, interestingly, I was never asked actually at all about any of that. It was just kind of, I was met where I, meet the patient where they are. It doesn't matter now what has been or what risk factors may or may not have been present. But, obviously sometimes patients would be asked about risk factors. Do you drink alcohol, or, are you a smoker? Do you get exercise? And you could feel very, you know, blamed in that moment. So I think I tried after my experience to really not go there too much with that discussion after my experience, because I was just thinking, okay, we just need to meet the patient where they're at now. And not become too focused in on these risk factors, which can actually make a patient feel very like, you know, blamed or hurt, or making it feel like, that it was something that they did, rather than just vast majority of the time it's just a combination of, genetics and some bad luck.
And you do find your experience has changed how you approach patients there in Merlin, but also normal people like your mates, like your friend who's diagnosed with skin cancer. Me, if I tell you I have a pain in my back or whatever, has it completely changed how you talk to people?
Yeah, 100%. And the big thing is that I've learned is just shut the fuck up. Just shut up. Like, you don't really need to say whole pile. You don't give advice. Don't give unsolicited advice. I know I gave you some advice for your other half yesterday, MT, and a problem.
But I offered.
But you know what? Just don't give advice. Be a listening ear, and I'm here for you if you need me. And then just keep it simple. The less you say, the better. Be kind, be nice, be a listening ear. Don't look for explanations. Don't look for solutions. Don't offer. Go give advice. I do not give unsolicited advice when a person is sick. I think just leave the person deal with their doctor. For that piece. So if I'm patient, if I have a friend going through something serious, like fertility, for example, that's another good one where there's a lot of blame. I will do nothing except just wish at my friends well, and just don't give advice. I think that's a good rule of thumb, because advice can be interpreted. You don't know where a patient is at. If you say to somebody, "Oh, I read actually that walking 20 minutes every day can improve IVF," or something like that. You know what I mean? That's not a real statistic. That person could just feel very blamed in that space. Then and think, "Am I not walking enough? Is this why this is not working?" So I think just unsolicited advice, um, and just leaving judgment at the door. Meet the person where they are and just be supportive, be a listening ear. That's how I've changed, I think, hopefully. If I ever deviate from that, guys, let me know. We're only up now.
Well,
Like,
if you
that's
have to say-
there's two bits really. There's the interaction with the healthcare professionals, and then there's everything else outside of that room. So, you know, well, like, let's say, I mean, obviously my example isn't as serious as yours in terms of it was my gallstones or whatever, but you know, people tend not to. I think as doctors, we get offered less unsolicited advice, I would say, because we can rebut it with "that's BS, shut up, I'm not going to listen to that." But I know that certain relatives and friends of mine have been given a lot of unsolicited advice. They've been sent links to certain diets that will cure their cancer, or for me, when my gallbladder was taken out, I was bombarded with, "Oh, you won't be able to digest your food anymore because you don't have your gallbladder. You need to take this diet or that diet." And like, my gallbladder hadn't worked for half my life, so I didn't miss them the lightest, and neither did my body. And I don't need that advice. I need more practical help. Like, I can't move because I'm in so much pain after the surgery. Can you look after my kids? And don't be sending me this BS link for some fermented diet. And it's like, just, yeah, butt out. Like, I get the advice that I need from my healthcare professionals, and I don't need the latest Instagram post or conspiratorial TikTok. That's not going to help me. And it must, if it was bad and irritating for me, it must be a million times worse for something like cancer.
Totally. Or if it's something for your children as well, and that's it. Like, if you need the practical help, it's because somebody sends you, a link for a diet, and you're like, post-op, you're trying to recover, you're thinking this, is the last, random thing I need at this moment in time. And people, giving, I think, I would see it a lot, say, in parents who have children with type 1 diabetes. And I see it online a lot, actually. Recently, I saw an interaction just between two commenters in a post that I had. Somebody had asked a question pertaining to type 1 diabetes, and somebody else came in and said, well, I actually reversed my diabetes with this, 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 and this. And the commenter said, well, yeah, I got type 1. There ain't no reversing that, hon. That is an autoimmune condition. And I feel in this conversation, it's people with type 1 diabetes actually get particularly, it's a particularly difficult space for them, because I think a lot of people think that diabetes is all down to diet and lifestyle. And actually, even it's an autoimmune condition, where like the cells attack the pancreas. Like, you can't. It's nothing to do with the person's diet or lifestyle. And the more we learn about type 2, it's more. It's less really. It's not not all about. It's mostly genetics again.
It's also genetics. Yeah. Yeah. I come from a long line of type 2 diabetes. And, sort of conscious that I may head that way myself, but no matter, I could do everything that I need to do lifestyle wise, and it could still come knocking on my door. The type 1 diabetes is particularly difficult for parents of children with type 1 diabetes, because the assumption is automatically, oh, they've given them too many sweets. It's just like,
Yeah.
that could not be further from that. Their pancreas has failed because it's been attacked by their immune system. They can't produce enough insulin. They could live on a diet of plain pasta and water, and their sugars will still go through the roof. It's got nothing to do with their diet. And yes, in the past, certainly before we had the pumps and the technology, they would have had to restrict what they ate in terms of, well, they still do have to be careful, obviously, but they couldn't eat anything sweet at all. And that, I think, maybe fed into the perception, oh, well, it's because they ate too many sweets. And it's still there. I can't believe it. Like, in this era of information, that dis and misinformation will always trump facts, and it's just infuriating.
It's still so prevalent, like the type 1 thing, and I can think of, two distinct children and their parents in the room with me when, the diagnosis was made, essentially. And just like lightning speed. Oh, I've been giving him too many treats. No, like that's not what this is. This is nothing that you did. But people, they suppose in the context of this conversation, really do blame themselves a lot for ill health, when really, a lot of the time it's actually nothing that you've done. It's mostly your genetics. I mean, I know that there was a statistic from the HSE came into my inbox last week, and it said 4 in 10 cancers are preventable. And that's great. But, 6 in 10 kind of then they're saying aren't, and that's the majority.
Yeah.
And at what point, Darren, did you kind of come along in your journey from being diagnosed, and I'm sure being like stunned, angry, upset? I'm sure you went through all the grief cycles with that. How long did it take for you to come out the other side to realize I am blaming myself for something I couldn't have helped?
I can't recall empty. I suppose it was very, 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 very slow progress over time. I think I was hugely reassured when I went back and I looked at my cervical smear history and everything was up to date there. And it's like, okay, great. Like, I'm not in trouble. I was worried I was going to get in trouble for causing all this hassle, you know.
Who were you going to be in trouble with? Like, who were you afraid?
I was frightened that there would be this narrative amongst my family, like my nuclear family and distant, and just like my and wider family, that look at all of this upset she's caused. She's caused so much upset for all of these people. Like, people are devastated, as she caused it by not being up to date with her smear test. I was terrified. I remember distinctly having a really sleepless night about that, just thinking I am in trouble, because if I made a mistake here, I made a big bad mistake and I've caused everybody all of this hassle. And that was that stands out to me, as just as a sleepless night I had. And then as well, like to be really clear, to be crystal clear, the doctors and nurses that took care of me never once made me feel anything other than just, Jiren, we're here to help you and we are going to get you better and it will be okay. And that was all I was met with at the hospital. But I felt like I was trying to I wanted to present myself to them as somebody who was like, oh no, but I'm organized, but I go for my smear test. And I remember saying a few times, like in the hospital, saying to the doctor, like, I exercised and I thought I was healthy. I thought I was healthy. And I remember it was like this like existential crisis where I had lived my life to that point believing that I was healthy, and I had this belief system that I was a healthy person because I don't drink, I don't smoke, I exercise, I get vaccines, I do all the health things. And then it felt like it almost felt to me in that moment around that time that like I had lived a lie to that point because I was thinking, but I'm not healthy. This is I can't get my head around this. Um, so it just, I suppose, again, all of that to say, like the complex layers of emotions that people feel when they're diagnosed with an illness. And I remember then talking to my husband about it, being like, oh my God, like this is what patients feel when we tell them they have an illness. I had no idea this is how people felt. Because I don't think it was never something that we touched on in medical school. Maybe it's different these days, but I had no idea that it could cause like this existential crisis in someone. And then I was very in tune to it when I went back initially, but then I kind of deconditioned and because when you're a doctor, there's you have to go in and do a job, and you can't go in and be, bereft.
It doesn't help if you're like over empathizing with people. It
Else,
doesn't help
it's
them.
this you've got to go do your job, and you've got to be the steady head for the patient as well. So at first I was very, very in tune. Now I'm in tune, I'm aware, but obviously, you're just with time, those feelings have become less acute. But I am much more aware of it now.
I think as well though, there's a personal, you kind of wonder yourself. Well, first of all, I think the fact that we always think we've done something wrong when we're sick, that's a very human thing. Like I was giving you the example the other day. If Snoopy, the dog, got sick, he wouldn't waste any time like blaming himself, nor
You
would
really
I
eat too many dailies at the guard.
yeah. Like, oh, buddy, I hadn't eaten that big poo. Oh,
Yeah, yeah.
like he's not, it's a human thing to feel that we have such belief that we can control our environments and control our bodies that, that it's like, I could have prevented this. I could have done something different. Therefore, I must have done something wrong. That's the first piece. And like, so if I bring the dog to the vet and he's got gastro and the vet asks me questions like risk factors, I don't feel shamed or blamed or, Snooky doesn't feel bad about it. He just wants to get better and I just want my dog to get better, right? But when it's when it's a human, like if I'm bringing my child to the doctor, there's a lot of like, God, have I been feeding her the right food? Or, is she up to date with all her health checks? And there's that sort of instant, what could I have done differently? And then you've that bit. So we shouldn't ever feel if we get sick that we have done something wrong because other people can do the same stuff as you and not have any consequences. That's the first part of it. And the second part of it is, even if you don't feel that you've done something wrong, you can be bloody well sure that somebody out there, somebody well-meaning, is going to chime in with an opinion that
Mm.
you have somehow or somebody else has somehow done you wrong, and that's where you're sick. So you have the personal part and then the societal part as well. And as you say, Duran, really what society needs to learn how to do is shut the F up, and just butt out. It's not your business. Unless somebody is specifically asking you for advice or assistance, you shouldn't offer it.
It's funny actually, Neve, when you like just your gallbladder example, I'm sure your diet is probably a hell of a lot better than mine at the age of 25 and still is to this day. Just the pair of us here standing here, I still have my gallbladder and I can tell you I've probably eaten a lot more fast food than you have over the years because, anybody who knows me knows I get my graw for Supermax, and if I haven't ended up in hospital needing my gallbladder out, and you did, as an example, but like you'd be guaranteed if my gallbladder came out, that'd be the first thing, oh, Supermax.
Yeah.
Those snack boxes, that garlic cheese garlic cheese chips, that did it to her. And, potentially at some stage my gallbladder might start rumbling. And I know for me, that's the first thought I would go, God, I shouldn't have had all those takeaways. But like I had to eat. I was on the road. I lived on the road, and that's just a very small facetious example. But like even like you two had two very different but very serious in their own ways diagnoses. You needed surgery, and Darren also had to deal with a cancer diagnosis. Like for me, the only kind of I just been very lucky. That's all it is. I haven't had that big diagnosis or time to have to go to a hospital really to be looked out for, except like I do remember in my early 20s and I still use the word accused. If I tell the story to anyone, being accused by a doctor of being constipated. And I was not constipated. I knew I wasn't. I understood toileting and I wasn't. And then being told a young girl like you shouldn't be constipated, and she didn't even give me anything for the alleged constipation. So I was in the GP surgery with, alleged constipation, didn't give me anything for it because I shouldn't be constipated because I'm young, go out and walk, basically is what I was told. Anyway, a few days later, I passed a kidney stone.
There you go. That's and my first attack of gallbladder when I was 25, I was told I was constipated.
And like, but thinking in hindsight, now that I am a doctor myself, if I felt somebody who was 22 in front of me had constipation, I would give them something for the constipation. I would certainly give them something for the pain that wouldn't constipate them, by the way. And I'd try and get things moved along. And then I might say, these are things we can do to improve constipation if that is potentially what you have. But, it wasn't referred for any imaging, wasn't, and then I ended up in ED a few nights later and had a kidney stone. And yeah, that was sore. But it turns out that's what it was. But even going home, mother asked me, what's wrong with you? And I was like, nothing. She said, it's nothing. Because I didn't even want to tell them. They think I'm clogged up. And that's a very small basic thing. And I do remember thinking like, what have I done wrong here? That was ringing in my head. A young girl like you shouldn't be constipated. Now, maybe I just caught her on a bad day. Who knows? But, and it's a very small minor detail, but I'm wondering like potentially, and who knows, maybe she didn't even say that. Maybe that's what I heard. And that was because, I think we like to hear messaging. And when we hear somebody has a serious illness, your first question is, did you smoke? I don't smoke, therefore I'm not going to get lung cancer. I think that's what we do. And maybe in my head, I was thinking, sure, I'm exercising. I was playing football at the time. I drinking loads of water. I lorry the water into me. I couldn't possibly be constipated. Now, it turns out I wasn't. But even if I was, so what? Just deal with it. And I think that's our own internal biases and being afraid to tell people. Because I remember I told my sister she thinks it's constipation, and my sister's still laughing like 20 years later. So, I think we have a bit of that as well. We try, our survival instinct is like, well, that won't happen to me because I look after myself more.
It's almost it's like it's a societal inoculation. It's like, well, if I find out that, let's say for example, somebody I know who a woman in her 50s had a stroke, and again immediately led with, I never smoked, that kind of, and feeling that they had to, because what she was getting relentlessly was people asking her, did she smoke? Because they felt, well, if she smokes, well, I don't smoke, so it's not going to be a risk for me. So it's like a self inoculation. It's like, well, if I can establish now the facts here of this person's problem, then I can rule it out as a potential problem for me. And they've no idea how bad the person on the receiving end of that questioning feels.
This is it. And I suppose like as like humans, as we go through life, like we like to believe that we can control, like there is cause and effect. And like X happened because of Y. And we could trace everything back. And like you have to, I suppose, day to day, that is largely true. I do this and I get that. And so this feeling of accepting like this real lack of control about something as enormous as your health and your life, like that's very hard for us to accept. So, I think that when people, hear of somebody getting an illness, like if it's, somebody with liver disease, did they drink? If it's somebody, with diabetes, are they eating, lots of sugar? You got a stroke, are you a smoker? Lung cancer, are you a smoker? Those questions immediately pop up because we're trying to think, well, there has to be cause and effect. Because if there isn't, then that's quite scary. Because then I'm just out here in the ether and anything could kind of come for me. And so I think, trying to kind of make sense of like these diagnoses that sometimes don't make sense. They just are, bad luck. And as we're saying, a combination of, genetics, and a bit of bad luck, and sometimes they just don't make sense. And that's hard for a patient to, it's hard to stomach, when when somebody is confronted with that.
Yeah, and it's a long way from aesthetics and that side of medicine. This is the sort of the heavy side of medicine, and like I think personally being on the sort of the side where I'm the person delivering the diagnosis. Um, I think I think since having kids, that the way I deal with those interactions has changed with parents very much. Because I know that literally anything can happen with kids. You cannot control from one second to the next what they're going to do when they're small, and then when they're older, things get in simpler in some ways in that they can look after themselves, but more complicated from the sort of mental health side of things. And so I do find that I'm a bit more um, circumspect in how I deliver sort of news to parents. Um, but I think we all hope as doctors that we've never made patients feel bad about themselves or bad about their diagnosis. But I think it's almost locked into the consultation as well, because we do have to ask about risk factors. Um, but that's not, I suppose, to establish why they have the condition they have now. It's more to look towards the future and how perhaps lifestyle changes could prevent other things in the future. Would that be fair to say?
I think so, yeah. I think at the end of the day, there are risk factors. We do know that if you do certain things, your risk increases. But I suppose what we don't know is how much it increases by. And we also don't understand why somebody can smoke 80 a day, start their day off with vodka, never exercise, eat takeaway morning, noon, and night, and live till they're 100. So that's where the genetics things come in. We don't know. And I think we'd be doing patients I think we would anyway, we'd be doing patients a disservice if we didn't lay out the facts. And I think that's where both of you already touched on. You can't over empathize. And that was something I struggled with. I do remember being on a palliative rotation and sometimes the inside of my mouth bleeding, holding myself in so that I wouldn't cry in front of the person who was getting, when you're in palliative, you already are seriously ill and now you're getting word that the end is nigh. And they're crumbling, the relatives around them are crumbling, or sometimes the patient is quite stoical, they're taking this information in, they don't need the trainee doctor in the corner over there, bursting into tears thinking about a life finishing up and all the people who's going to be sad after them and the dog, and that's where I was at, because I suppose I was younger into medicine than you two are, and I have to learn very fast that patient doesn't need that. They need me to be able to empathize, to be able to answer any questions they have. And if they ask questions, risk factors, for example, did my smoking cause this? You can say, we don't know, potentially, but you can't say absolutely not either. That because we don't, you know what I mean? It's a thin line and it's a hard one to navigate. And I'm not sure any doctor gets it right 100% of the time. And I suppose if anybody took anything from this conversation, I'd like them to think that for the vast majority of us anyway, we try really hard and we could only apologize if we ever made anyone feel that way. And also, I think put yourself in the patient's shoes, like Thurin was saying, and even what I was saying about my very small constipation example. Maybe the GP never said it that way, but maybe that's how I heard it. Because we hear things differently when we're feeling, I suppose, under pressure or
I
in
think I
danger.
think we're primed to feel judged, and
Yes,
because we've already judged ourselves so much before we've ever even had that consultation, that
Yes.
that's kind of we'll hear a tone or a phrase will be taken in a certain way, and we'll feel judged by that, even though that may not have been the intent
It's
behind what the doctor or the nurse was saying.
that's so well said. It's because we are judging ourselves, so then we're primed to feel judged. And I think as well, if a doctor is running through a list of, questioning and its risk factors, so a part of that is the doctor trying to make sense of this as well themselves. They're trying to piece the thing together, say, how did this happen to my patient? How are we here? They're trying to make sense of the scenario. Um, and I think as well, MT, the way that GP said to you, a young girl like you shouldn't have constipation. I think she was saying it to herself. I think she was saying, this young girl has abdominal pain. I don't really know what this is, what's causing it. Maybe it's just constipation. And then she said aloud, She said the quiet part. But she was saying it to herself, but it doesn't make sense because a young girl shouldn't be that about it and you weren't. So it was like she was saying it to herself. So she was kind of reasoning this thing to herself, you know, but she said it aloud.
Did you ever feed it back to her empty?
No, I didn't actually. Thankfully, I haven't been to the doctor that often, and that's a long time ago now. Like, but I think just, and it's only a small interaction, and I'd forgotten all about it until we said we might start discussing this, and I was thinking, did I ever feel that way? And I think that was possibly the only time I ever felt a bit judged. But again, maybe like you said, I went in primed thinking I have the stomach by now, and maybe it wasn't. If you stopped eating all those takeaways, maybe your stomach could be collapsed.
Yeah,
Maybe I had that in the back of my head. I don't
Mm.
know. And like I said, maybe she said the quiet bit out loud, or maybe she never said it. And maybe that's what I took, and I think sometimes too, I have heard of, interactions and I wonder, you know, did the doctor or the consultant ever actually say it that way? And I have been in situations, for example, when you're traveling with the team, the consultant, and then the more junior doctors,
Yeah,
a lot of
the crocodile tail at the back.
yeah,
Yeah.
exactly. And oftentimes I would be the last person leaving a room, so I might be taking notes, whatever. And then a patient might ask me, the doctor said this, and I'm thinking, no, he or she didn't actually say that. And that's not to blame the patient again. It's just because they're being bombarded with information. Usually, first thing in the morning, the consultant goes in. How are you? Good morning. Pulls the curtain open. Did you pee?
And those magic curtains that nobody can hear through. Yeah.
Exactly. So you're
Yeah.
stressed out that your neighbor next door, like 3 feet away in the bed, if you're lucky, if you've got 3 feet, is hearing everything about your toileting habits, as an example. And then, the doctor says, "Oh, we want to send you for a scan because we want to see something on your liver," as an example. And then they disappear, gone off again, and you're like, "Oh God, my liver, what's wrong with my liver?" So, this is not to blame the patient anyway. But again, sometimes I think we say things, and maybe it's the way we're delivering the message that the patients sometimes hear different. And because I have found here in the clinic here, it's an aesthetics clinic. Thankfully, I don't do anything serious like that, But I have found that when people are on the bed getting something like Botox, very simple, then they tell you, I've this diagnosis. Somebody in my life has this diagnosis. I'm very stressed out about this. I feel like I brought it on myself. And even to use a very facetious example, like sometimes people be asking about skin health. And, or I might say, yeah, I'm not sure your skin will tolerate this as a treatment, as an example. Like, oh, that's my fault now. I drank too much. I didn't wear my SPF. This is my own fault. I look like a bag because I didn't look after myself straight away. And, we all go into, I'm terrible because, instead of coming in and say, I'm alive despite of everything the world has thrown at me. And I would see it in exercise psychology a lot as well. Like, my background is sport and performance psychology, and I used to, don't use much of it anymore, but like some forward-thinking GPs used to refer patients to me who decided, I do want to try and get an exercise regime that works better for me. And we were talking through, like, I suppose, your mental challenges and obstacles to exercise. And they always came from a point of blame. And it would take a long time of deconditioning to explain that the only time in life where we're conditioned to enjoy exercise is when you're a toddler. And then, the world, we come out of the factory perfect. And then the world breaks us apart bit by bit. Like, you're sent into school, you have to sit down, and then you're conditioned for 20 years to sit at a chair all day long. And then we wonder why we don't like our heart being under pressure when we run up a hill. And some of us are just better at dealing with that than others. That's a very simplified example. But like, the feeling of self-blame, self-loathing, and then the feeling of loathing, for example, if they decide, thanks be to God, we have the now weight loss medications. And like, some of them be afraid to tell me they're on them. And I was like, no, whatever rocks your boat, whatever is working for you. And like, you can see the sense of relief that I wasn't going to be that healthcare professional, because they do still exist out there who judge people on weight loss meds. And like, this is a medication. We now know what most of us, except for example, that obesity is a condition and that needs to be managed. That is not just a lifestyle choice. Somebody didn't choose to be overweight. But I think the way we talk to people and the way we deal with it. So my approach now is very matter of fact. If I have a patient in here and when they go down the self-loathing route, and if they do have an increased BMI, I do just say straight out, have you thought about weight loss medications? And I give them the knowledge. And I tell them, this is not to judge you or anything. And most of them, I hope anyway, God knows how some people listen to this, they go, she fat shamed me. But like, for the most part, I say, these are there now. Why don't you go and speak to your GP? This could be an option for you. And they go out with knowledge rather than going onto TikTok being weight shamed because they open the fridge,
Yeah. Yeah. And look, thankfully, the whole dialogue around overweight and obesity is changing massively. And it's about time. And it's about time that we sort of understood the sort of biology behind it. I wanted to go back, during, we nearly came to blows in the WhatsApp group about certain celebrities looking too well when they had cancer.
Yeah.
We won't
Like,
name
it
names.
was another part of like that apart that people don't believe somebody is sick if they don't look sick, that, if you don't look sick, then you are not sick. Or if you're doing X, Y, and Z, then you're not sick. Or if you're smiling or you're happy or you've put on makeup, then you're not sick. You're not sick enough. And so that's another part of the puzzle of like the identity, or the picture of illness, and like more of the judgment that goes along with illness. People have an idea of what a sick person should look like, and if you don't fit into that picture, people feel a discomfort, and maybe sometimes don't believe, how if say if a well-known person, um whether or not they are sick as they say they are, so that's another facet of the whole thing. And then there's the thing, like MT, you were saying, people sometimes feel ashamed about disclosing to you medications that they're on. And you had said, and I had never really properly appreciated this, that sometimes like you can see a lot in the exercise and the sports psychology space is, the kind of the rhetoric of don't go to the doctor, they'll just put you on a bunch of medicines, exercise your problems away, exercise your illnesses away, exercise your diet away, or your diabetes away, exercise your low mood away, exercise your insomnia away. um and then I suppose that comes into the like stigmatization of illness. You say, don't go to the doctor, they'll give you medication. You don't know whether or not that's true. You don't know if the person needs medication. So it's stigmatizing illness. It's stigmatizing pharmaceuticals when they are, life-saving, life-prolonging medications in the vast majority of cases. Nobody is put on a pharmaceutical that they don't want to be put on. It's your decision if you want to take it or not. The stigmatization of illness, and then again, that comes into the unsolicited advice piece. If somebody is saying to you, that they, aren't sleeping well, or they, if they do have low mood, or something like that, or anxiety, depression, you can stay away from the unsolicited advice. What you can do, and that is helpful, is, listening ear and signposting, to appropriate services, like in the first instance, typically GP. And and I thought that was an interesting insight, that stigmatization of, don't go to, they'll just throw you on medicines, and that's not true. GPs try to avoid medications where possible.
Well, like all doctors do, because I think that mindset comes from, one, the failing at life mindset, but two, we're on this planet long enough now to know that every medication, from a paracetamol to the most powerful medication there is, can potentially have a side effect. And people have had unpleasant side effects from various medications over the years, and that gets into the ether, and you're like, well, you can't be on that tablet, it'll make you faint, and that gets into your head as an example. But even like, it's funny, and I think the younger the patient, or the younger they might perceive themselves to be, the more of that stigma is there for meds. Like, I have come across many as a patient who has refused a daily tablet for blood pressure, as an example, and then they're going around with the feeling of failure because they feel they're bringing this on themselves because they haven't lost weight, they're eating bad food, in quotation marks, forgetting again that sometimes you could do all those things and still have increased blood pressure, and just that daily tablet will help, or a tablet for cholesterol. There's a feeling anything that's attached to a stigma of you not living your best life, or the way public expects you to live your best life, that stigma is there. And I have to say, I was surprised kind of when I went studying medicine, at how much, cause not cajoling isn't the right word, but explaining to patients the pros and cons of taking a medication you have to do. Because I know I would prefer to take a daily tablet for blood pressure I can't control, than trying to control factors I can't control. I just use that as a very small example, but and then you're thinking, like, can you imagine then what it must be like for somebody who's had those interactions from the world around them from the get-go? Like, for example, the person we bring back to type 1 diabetes, you're diagnosed at the age of 3, and then maybe from the age of 5, you start kind of getting this messaging, and then by the age of 10, you're exhausted by it, and then by the age of 13, you're really tired of it. And I can understand, and I'm sure Niamh has probably seen many as an example. It's a known phenomenon of, like, teenagers with a chronic condition, kind of the age 13, 14, they're like, I can't be eating this anymore, and they kind of just want to throw all the meds away, and they'd kind of derail for a while.
I know it's relentless. It really is. And then you have the sort of messaging. Oh, it's stress. It's
Mm.
stress. You know, if we all lived in the fields, harvesting crops every day in the old agrarian ways, where nobody was ever sick and we had no stresses, then we would all be healthy. Like part of the human condition is stress, and the stresses we have now are obviously very different to the stresses where we just had to scrape things together. We all seem to be under the illusion that we'd be the people living upstairs in Downton Abbey as opposed to the ones in the kitchen, whereas we would not. We're deluded if we think that. And our lives here on this island 50, 100 years ago were stressful in different ways. The stress of keeping warm, the stress of keeping fed, the stress of having light. As the west of Ireland is unfortunately rediscovering at the moment, this sort of wistful looking back, that we had this idyllic bucolic lifestyle 100 years ago. That's not true. And you can't there's always going to be stress in life, and being told not to be so stressed and you'll be much healthier is another really sort of delusional way of giving people advice.
True. And even then there's the blame of stress. You're blaming yourself for being too stressed, like, oh, I'm too stressed, I get too worked up. So people blame themselves then for being too stressed, or, too stressed. Um, and, stress can make a lot of conditions worse. It can exacerbate a lot, probably most. I don't think there's stress can make any medical condition better. But stress is a part of the human condition, Niamh, and then this thing of, like, trying to find time to manage stress is very, very difficult in, the modern world with all.
Trying to manage.
I'm so stressed trying to do my gratitude journals that I don't. Ah. Oh, yeah, it's stressful trying to manage your stress.
Exactly. And then the person, like you said, selling the gratitude journals is lying on a hammock somewhere in Bali making a fortune selling gratitude journals to stressed out Irish people in the west of Ireland with no light or heat. And they're stressed out because they can't open up their book to write because they can't see. Like, yeah, I think that wishful thinking probably is, again, a mode of self-preservation. It's people who don't like change and they kind of think 20 years ago things were better, 30 years ago, sure, weren't we all fit and healthy 50 years ago? Nobody was vaccinated. We're all out working in the fields. And like you said, we all thought we'd all be living upstairs in Downton Abbey. But even the ones upstairs in Downton Abbey had their stresses as well. Do you know?
Yeah.
But like, we do think that, and we think, we hark back to the days where life was easier and simpler. But like, yeah, people died and got sicker earlier back then, and like we've advanced a lot. And I think with that advancement, we're kind of, I don't think everyone is always 100% comfortable with it either. And I think all that feeds in to this world we live in where we feel the judgment, even down to the fact, like, when my baby was born, she was very bad with colic. The amount of people who told me, with anyone who's watching this on screen, doctor, in the first type of my name, did you bring her for the cure? And then you were nearly getting judged for not bringing her to the cure because, sure, what harm could it make? Why don't you try it? Sure, you're leaving the child suffering. And even me, who knew this was ridiculous, in my sleep deprived state, by about week 5, I was thinking, geez, what harm would it make if I went to your land and rubbed some duck feathers on her back?
What's the local cure for colic in your area?
I have no idea, but apparently there's somebody in a few different. This area is mad for the cure. There's loads of cures around here, and people will swear by them.
Yeah.
And my theory is, with the cure or with remedies or tonics or whatever, if it's not going to do you any harm, knock yourself out. Go
Yeah.
do for it. It makes you feel better. Just go do it. For me, I knew bringing my child for a cure was not going to make me feel better. If anything, if her colic took a turn for the worse, like, oh God, I brought her for the cure and I'm out killing my child. So I go the opposite end completely. But even in that sleep deprived state, after week 5, week 6, week 7, what very well meaning people were asking me, I sat in the car. I remember we were on a day trip, as I called it at the time, out for the day down in Croke Park. And on the way back, turning to himself and saying, so and so, and she's sensible. She said maybe I should bring her for the cure. And he's like, oh, come on now, you need to go home to bed. Because if that was hitting me, and I just have the benefit of a medical degree, that's the only difference between me and normal Joe and Josephine Soap in the street, who don't have that kind of knowledge behind them. Like, I understand it, I get it. And then, funnily enough, then people would nearly feel guilty telling me they brought their child for the cure. So there's guilt in every which way.
Yeah. Yeah, exactly. I mean, I think that the whole sort of cure side of things is absolutely fascinating. I actually have a book about Irish cures. I think just and for the most part, now there are some charlatans out there, as there are with everything, but for the most part, they're very, very well-meaning people, and I would never judge anyone if they told me they'd been for a cure. Absolutely not. But that's the thing. There's, like you say, there's judgment every which way. People are going to feel judged because they went for the cure. People are going to feel judged because they didn't go for the cure. People are going to feel judged because they went to the doctor. People are going to feel judged because they didn't go to the doctor. It's relentless. And like, we are sitting there as doctors in the middle of all of this, trying our very best not to be judgmental, and I think doing a pretty good job. I think we've come a long way in terms of as a profession. And you know, certainly when I was training back in the 90s, some of the interactions I saw between doctors and patients were highly, highly questionable, particularly in the field of obstetrics, I'm going to say. But that has improved a lot. But there's a lot more to be done.
I think it comes back to what Darren was saying, which is basically shut the fuck up.
Yeah. Yeah.
As doctors and normal people, I use the phrase normal people all the time because I just feel like
Is your remote
well,
after doing medicine?
I'm definitely not normal, but I feel like for me, when I go into doctor mode is very different to MT mode. Like I have to be professional. Like the amount of people who said to me, you know, because I live in an area where I'm not from, you know, they go, Jesus, you're a doctor. I was like, I know. And you wouldn't trust me either. I get it. Like, but I feel in my head that Dr. MT is very different to normal MT. So that's why I say normal people, which is the wrong phrase out. Somebody's going to feel judged now by that as well. I've even forgotten my point because I'm a crap doctor. What was I going to say there?
I don't know.
It has like our doctor head or like our doctor voice. It's like your telephone voice, and then we just go out and just like, you know, be our normal self.
Yeah,
Um,
isn't it funny? Like, but I think it comes back to just not judging each other and just learning to be quiet. And I think that's something we all have to learn, be it doctors or not doctors. And I think a lot of well-meaning people give well-meaning advice, and a lot of people do too, just to give you a little jolt. I think some people do to be me. Let's call us.
I think a lot of the time as well, it's to fill a silence. And it's like, you know, be okay with silence. Be okay with just saying nothing or just, you know, I'm here for you if you need me. You know, like just be okay with silence. Because again, it's like the thing where we always need cause and effect. Or somebody comes to you with a problem, like, you know, my baby has colic. How can I help? Let me think.
You know, actually, not one person said, I'll come into you and stay the night so you can go to bed. Not one person said,
Exactly. Exactly. You
Yeah.
know, and I suppose I was, you know, I think gosh, you know, if my friends are, you know, having a hard time, like with babies or kids or whatever it is, I will, you know, I'll just say, like, if there's anything practical I can do, just let me know. Like whatever that might be, just let me know and I'll try to do it. But I think it's, you know, when I with one of my babies had reflux, and like I was advised to, like, it's just not my thing, and I think it's okay, like, for some people that it is their thing, like, go to, what was it? Like a baby yoga class, like, this is just not my vibe. And then a an osteopath again, it's just not my thing. And then eventually my baby was with Neve for a different reason, and Neve, like, spotted the reflux, and then Neve just, like, was like, "Have you tried Carabel?" It's like, "No, I haven't." And, like, that was, like,
Try
life.
talking to a doctor.
but actually, that's a good place to kind of bring up in a tangent back. Have you tried talking to a
Can I just
doctor?
say though,
No, go on.
like, I mean, so it was just a nice illustration of like a consultant pediatrician who knew what she was talking about,
Yeah.
you know, and it worked. It worked.
Good
Beautifully.
lass.
Parabel is so
Yeah,
appreciated.
I know. It's a
But like
wonder. It's a wonder.
you brought up a point actually there and that I meant to bring up, which is that as doctors as a whole, you know, people I think expect us to never be sick, never to be unwell, and like you're now again maybe they don't, maybe this is ourselves taking on judgment from society that doesn't even exist, that we kind of feel judged if we're sick. You know, how could a doctor be sick?
Or that our children won't get sick or something. Or that we know, you know, what to do all the time. Like actually my eldest boy, I can't remember what the issue was, and there was something. And I remember I had like a meeting scheduled for the Friday, say. And I just said to the person that I had the meeting with, I said, look, I've got this issue with my boy. and if it's not resolved by Friday, I'm bringing him to the GP because I need an opinion at that point. And she was surprised I would bring my child to the GP. And if my children are now, obviously, look, I do have the insight, if there's a fever or, a viral illness, I say, okay, they're taking fluids, they're wetting their nappies, they're grand, don't need a GP, or if there's, a rash, I can know, obviously I do have insight. But I do take my children to to their GP when they're sick as well. And that person was surprised by it. And then, I'd mentioned another visit for myself to my GP. And she said, darling, it's just so weird to me that you go to a GP and you're a doctor, but
But
it's
essential
natural.
that we do. It's
Yeah,
essential.
yeah.
I go every 6 months.
Yeah, me too. I see my GP a lot.
Yeah.
Yeah, and I think people are surprised by that. And I think it's somewhere some doctors do fall and fail on that they don't go to their own GP, especially I think doctors in training because they're rotating around the country and might not have a regular GP as an example. And I think people are surprised to hear, yeah, I went to the doctor too.
Sometimes you can't, they don't say trees.
No.
You can't, diagnose yourself. Sometimes you can't really kind of, it's that thing, and you just don't have that objectivity.
No, and you shouldn't either,
Exactly. Or, I had abdominal pain recently. It turned out to be nothing, but I asked my husband, I was like, could you look at my abdomen? He was like, no, like, go to your GP, like, do it the right, just go to your doctor. So
Be normal.
You're a normal person.
yeah. Oh, but I was like, I don't want to be annoying my GP again. Like, I see him a lot because I find, you know what? They were digressing now, but some people just, their presence is therapeutic. He's one of those people,
Kind of calm you down by just talking to you, like, yeah.
Yeah, yeah. Okay, we hit on all the points we wanted to chat about in it, and like I suppose the reason we wanted to have this discussion was kind of like to talk about that, like there is stigma around illness, and I suppose we have a long way to go until we change that, but just to acknowledge it, that this is how people feel.
Yeah.
Absolutely. And I think it's a good place to wrap this up now. And what we're going to do is we're going to wrap up this recording and then we're going to revert back to the WhatsApp group and persecute Niamh about various ailments we think our children might have.
I'll prescribe Carabel for everything.
We hope you enjoyed this episode and please continue to be part of the conversation with us. Please subscribe to our podcast, No Scrubs.